Now, compliance and elasticity. To understand compliance, I told you thick balloon have more elasticity, because elasticity is how they are returning back, and thin balloon will expand more. So compliance is the ease of expandability. More is the volume, more will be the compliance. Okay. In emphysema, because of decrease in the elastance, okay, there is increase in elasticity, and that causes hyperinflation of lung. In restrictive lung disease, all the parenchymal fibrosis, asbestosis, silicosis, beryolosis, tuberculosis, whenever there is parenchymal fibrosis, they cannot expand more, so compliance is decreased, like interstitial lung disease. Okay, is this clear? But in obstructive lung disease, volume will be more, so compliance will be more. I will discuss that. Now, normally compliance of lung and compliance of chest wall is equal, which is 200 ml per centimeter of water, or you can say 0.2 liter per centimeter of water. But if you combine them together, it becomes 0.1, because both are going in opposite direction. Lungs want to collapse, chest wall want to expand, so both are going in opposite direction, so it will decrease. So 0.2 plus 0.2 is not 0.4. Here 1 upon 0.2 plus 1 upon 0.2, it becomes 0.1. Is this clear, doctor? So compliance is the ease of expandability, delta V by delta P. More is the volume, more is the compliance. Elasticity is delta P by delta V. More is the volume, lesser is the elasticity. Now, compliance of lung. I have told you, even if the lung is collapsed, point number 1, I have told you, if you cut pleural membrane, lung will collapse. But volume of air in the lung will not be 0. This is again a myth. In a lot of books it is given, it becomes 0. But Harrison clearly says, Boron clearly says, even if lung collapse, amount of air inside will be there, and it is called as, please remember, please highlight this point, minimal volume. Minimal volume. That is 10% of total lung capacity. Whatever is the total lung capacity, even if lung collapse, 10% of TLC will be in that. Okay? And you know the maximum amount of air is always TLC. This is about the compliance of lung. Now, compliance of thorax. At the resting condition, if you cut pleural membrane, I told you, your thorax will expand. How much? 60% of TLC. Okay. But if you fill the air in the thorax, what is the maximum air in the thorax? Again, total lung capacity. And if you remove air from the thorax, what is the minimum air in the thorax? Residual volume. Now, coming to the third aspect, compliance of lung and chest wall. Right now, we have lung also, chest wall also. These two things are in the cadaver. When you cut the pleural membrane, so you can judge compliance of lung separately, compliance of thorax separately. But right now, when we are living in same condition, lung and thorax are together. Although they want to oppose each other, but they are together. So right now, how much amount of air you have in your lung? Is what you are saying? Tidal volume? No. Residual volume? No. Tidal volume is the amount of air you take in and out, in and out. Residual volume is the amount of air which you release after forceful expiration. Answer will be FRC, functional residual capacity. The amount of air right now in your lung when you are breathing normally after normal expiration is functional residual capacity. I will show you, don't worry. So normally is how much? Functional residual capacity. Maximum how much in us? Total lung capacity. Minimum is residual volume. So now you can see here. This is a wonderful diagram, and this will tell you everything about. So normally this is the red one is about the normal curve. Normal we have how much air? This amount of air. It is called as FRC. Can you see it? Normally at 0 mmHg, when you are standing like that or sitting like that, open your mouth. How much air you have? 0 mmHg. -1, +1. I have discussed that point. So at 0 mmHg, normal amount of air in your lung is FRC. But if you cut the pleural membrane, lung will collapse and it will come here, and this amount of air is called as, anyone can tell me? You can see it is not zero. Even if lung collapse, it is called as minimal volume. So even if lung collapse at normal atmospheric pressure, it is not zero, it is minimal volume, and thorax will expand. Thorax, the blue one is for thorax, the brown is for lung. Now this will expand to achieve how much? 60% of total lung capacity. 60% of total lung capacity. And you can see for everywhere, maximum is around TLC. Maximum is around TLC. Either you are talking about the lung or chest wall or together, and minimum for everything is about residual volume. Residual volume. This is the most important graph in respiratory physiology, which can explain in detail about the compliance. Is this clear, doctor? So I hope now this image is clear to you. Okay. If you are not clear, please pause the video, go back again and see this video. This is a wonderful video.